I'm going to be talking about pregnancy and breathing. I'm Dr. Louise Oliver, and in the NHS, I'm a GP. And in my private role, I work as a functional breathing practitioner and a therapeutic life coach. I truly believe health and well-being is a jigsaw puzzle of many pieces, and different pieces have different relevance to different people. One of those pieces is how we breathe matters, and sometimes this is overlooked, and it's really relevant for pregnancy. We have a system called the autonomic nervous system, which controls all our unconscious processes and is not necessarily healthy. And we need the autonomic nervous system to really assist us before, during, and after pregnancy and throughout life. And we can do things to make that autonomic nervous system healthier to support us through this transition. Breathing. We know that as women transition through pregnancy, it's perfectly normal for breathing to become more difficult. But what I'm interested in is what is the baseline breathing efficiency of that individual, and could we improve that to make it easier for the individual as they go through the pregnancy? Babies mimic others, and are they around people who are displaying healthy breathing patterns or unhealthy breathing patterns? So I'm going to break down each of these. I am delighted to be a contributor to Davina McCall's new book, Birthing. She's written this with midwife Marley Henry, and it truly is a brilliant book. It's holistic. It covers everything from conception, pregnancy, birth, and then the postnatal period. And it has all these experts offering their expertise. And I'm really grateful that I have written a section on breathing and how this is important for pregnancy. I've given a specific breathing exercise in there, and I hope you find that helpful. So I think it's really important that everyone understands a really simple explanation of the autonomic nervous system. And I explain it like this. It's a complex system, so this is a simple explanation. But in the background, without our conscious control, we have so many processes that are controlled by the autonomic nervous system. So blood pressure, pulse, the size of my pupil, how contracted my muscles are, my saliva, the amount of stomach acid, my bowels, my bladder, my bowels, my bladder, my genitals, um, even whether my hairs are flat or upright. All these different things are controlled by the autonomic nervous system. And we have two sides to this, both are on, but it's like a dial system that goes up and down. So one side of it is the sympathetic nervous system. You may have heard of this as the fight, flight, freeze system. And it's not a bad thing. It's a wonderful part of our body that when our body feels a threat, opportunity, or challenge, the body puts those unconscious processes more towards short-term survival. So this has been really helpful. It's helped us develop as a species and cope with adversity. The issue is sometimes this system's on too much and it's on too high a volume in modern society sometimes. On this side, we have inflammation, and that's a good thing. If you've got COVID, pneumonia, sprained ankle, you want that inflammation to be activated to try and deal with the problem. But when the problem's gone, you need that inflammation to reduce. We have the other side of the system, the parasympathetic nervous system. The lay terms are rest and digest, feed and breed, relaxation response. And when the body feels safe, it can go into repair and recover mode, and all those processes are pushed more towards long-term survival. The vagus nerve has a big role on this side and has the ability to try and reduce down that inflammation. So if we think about pregnancy, this is about long-term survival. So if we want libido, we want to be able to produce another baby, so go through pregnancy and give birth, that's about long-term survival. So ideally, we want that autonomic nervous system to be more shifted towards a parasympathetic nervous system, but we need both sides to be active because for example, if we take blood pressure, the sympathetic nervous system puts blood pressure up, the parasympathetic nervous system puts blood pressure down. But we can't have a zero blood pressure because we'd never be able to stand up. So we need a controlled blood pressure. So the blood pressure the autonomic nervous system is constantly making adjustments to each side of the system to deal with standing, sitting, hot and cold, etc. And can you imagine when someone's going through birth, what huge amounts of variation of blood pressure occurs. So we want a healthy nervous system. There is one way of monitoring this. You can use heart rate variability as a marker of health of the autonomic nervous system. It needs specific equipment, and at the current time, those that are just on a phone, my understanding is it's not that accurate at the moment. So now there's lots of different things that can um, help improve the autonomic nervous system. So such activities that would improve the parasympathetic nervous system would be meditation, gargling, singing, humming, calming music, maybe yoga, connection with others, being kind, and that's kind to self and others. All sorts of activities, being in nature, that can help improve that. But my passion is, what about the unconscious 24-hour breathing pattern? Because breathing and the autonomic nervous system are intimately linked. I'll give you an example. I was running, someone let go of a dog, there was no conscious control. I breathed like this because I thought I was going to be attacked. So it was fast, it was big, it was using the mouth and upper chest. And that was brilliant because my part of my brain, my amygdala, was looking at my breathing center and could see I had changed my breathing pattern and associates that with a threat, opportunity, or challenge, and sends a signal around the body to push everything more towards short-term survival. Perfectly appropriate in that scenario. Luckily, the dog owner got hold of the dog, and I was fine, and I knew there was the other side of the system, so I managed to breathe the opposite way. So I closed my mouth, I took really gentle and slow breaths through my nose and used my diaphragm. So my amygdala sees my breathing pattern change and then sends a signal all around the body to say she's safe. Now turn down the dial on the sympathetic nervous system and turn up the dial on the parasympathetic nervous system. And when I started snoring in my perimenopause, I was breathing like this when I was asleep. So instead of driving a parasympathetic nervous system response when I'm asleep, I am driving my fight, flight, freeze system. Now, luckily for me, I corrected how I breathed whilst I was awake, and now I breathe like this. And breathing like that when asleep allows my body to turn up the dial on the parasympathetic nervous system and shift everything more towards repair and recover. And the difference is amazing. And that's why I work half-time as a GP and half-time as a breathing practitioner. This is just one of my clients from my Breath Doc individual program, and this is an average heart rate variability as he went through the program. And as you can see at the beginning, his heart rate variability was lower. So we want higher heart rate variability. So a high heart rate variability is associated with health and well-being and less chronic disease. And as he went through the program, there's a period of calibration as his breathing improved and changed, and then his average heart rate variability came up. And this actually was an individual who had compromised breathing. So asthma, had obstructive sleep apnea, which I'll explain as I'm coming on, and he was already being treated by the traditional ways with a mandibular advancement device, and we got additional improvements. This is showing his autonomic nervous system is shifting more towards a healthier pattern. And he could breathe, he could now breathe in and out of his nose and run actually with nasal breathing, and felt so much better, and his sleep was so much better. So we come into the world as a baby that's been designed beautifully to breathe efficiently, but we're not necessarily living as nature intended, so we're not necessarily continuing to breathe in an efficient manner. So we know as women transition through pregnancy, their breathing will become more difficult. But what's the baseline? So if we're starting our breathing's efficient and we transition through pregnancy, it gets more difficult, we might find it okay. But if we're already breathing quite hard and fast, it's going to be even more difficult to cope with that pregnancy as we go through. And why does breathing change? It's complicated. Really brief summary here. 20% of pregnant women will get rhinitis, which is nasal congestion. And we also get swelling around sort of our nose and the sort of this area here. We gain weight, perfectly normal, but that means we gain weight around the tongue and around here. And remember, we're breathing through a tube. You know, you're lucky if you're breathing through a tube this size, and it's collapsible at this point, and it's vulnerable when we're asleep to collapse. And if we've got additional weight and swelling, that can potentially compromise breathing, particularly when we're asleep. As the baby grows, it starts to sit underneath the person's lungs, and that's where our main breathing muscle sits. So then it becomes more difficult to breathe with the diaphragm. Oxygen requirements increase and metabolic rate increases. So breathing. If you learn nothing from this, the only role the mouth has in breathing is making it inefficient. We have been perfectly designed to breathe in and out of the nose. And from my reading and experience, nasal breathing is associated with health and well-being. It promotes health and well-being. Yes, we do have the ability to breathe using our mouth, and that's helped because it's helped us communicate and talk. And perhaps at really high levels of exercise, it had an advantage to get away from prey or actually to catch something to help us survive. So from my perspective, nasal breathing is what we ideally need to aim for. The nose is an organ, it completely communicates with the body. My respect for the nose has massively increased. And if you want to read more about the importance of nasal breathing, please read both of these blogs. There's QR codes for both of them there, one on the nose and one on nitric oxide. So when we are asleep, we have been designed to breathe in and out of the nose slowly and gently. Unfortunately, we don't all breathe like that. I started snoring, so at one point I wasn't breathing as nature intended. But we're breathing through a tube here and it's collapsible. And there's a term called sleep disordered breathing, and that just means we're not breathing as nature intended. And that can be anywhere from sleeping with the mouth open, noisy breathing. There can be a resistance to the air coming in and out, and we call that upper airways resistance syndrome. And then the other condition that I've mentioned is obstructive sleep apnea. And that's a condition where the airway either completely blocks or it narrows enough. And when it does that, the body then at some point will feel a threat to life and will generate a fight response to open that airway. And if you've ever seen videos of people who have this condition, they have lots of muscle contraction, all sorts of the body activated to open that airway. The person might have dropped their oxygen, so they might have might have created lots of oxidative stress, lots of inflammation during that. And I think the worst result I've seen so far is one of my patients was stopping breathing 110 times an hour, and they thought they were just snoring. Okay, so we know that breathing gets more compromised as women transition through pregnancy, and they have a higher chance of obstructive sleep apnea at the end of the pregnancy compared to the beginning. Okay, and then the question is, what are the risks of that? Okay, so it's difficult. So I'm going to present two systematic reviews and meta-analysis that sort of come to different conclusions. Both were around the same time, and the reviews of this type are generally respected because they involve a lot of data and combining lots of different studies. So this study, the QR code is there if you want to look at it. They thought that sleep disordered breathing during pregnancy was associated with a significantly increased risk of gestational diabetes, pregnancy-induced hypertension, preeclampsia, but not significantly associated with fetal maternal outcomes. So, namely Apgar score and birth weight. So the conclusion was they thought there was potentially some evidence for an association between sleep disorder breathing and adverse perinatal outcomes, but it wasn't clear. Whereas this study came to sort of a different conclusion. They said maternal sleep disorder breathing was associated significantly with preterm birth, an infant with a 5-minute APGAR score of less than 7, stillbirth, perinatal death, and neonatal nursery admission. So their conclusion was maternal sleep disorder breathing is associated with increased risks of adverse intrapartum and perinatal outcomes. So a group of experts came together and have produced this consensus statement. Um, and actually, the final version of this guideline, the QR code is there, has been endorsed by the Society of Anaesthesia and Sleep Medicine, the Society for Obstetric, Anaesthesia and Perinatology, the Society for Maternal Fetal Medicine, and the American College of Obstetricians and Gynecologists supports the value of this clinical document as an educational tool. They pulled together the research that was available. Unfortunately, in pregnant women, it's difficult to do research. So where there was gaps in research, they went on expert opinion. They came to the conclusion many unanswered questions, both in screening, diagnosis and treatment of obstructive sleep apnea in pregnant people. They did say nasal congestion is common in pregnancy and it may impact adherence to the main treatment for obstructive sleep apnea. So CPAP treatment is where someone either wears a nose piece or a full face mask and it's blowing air into the airway to keep it open to stop it from collapsing. But if we've got nasal congestion, that's a problem. Their recommendations were this: assess pregnant people at high risk for obstructive sleep apnea, which they defined as a body mass index higher than 30, chronic hypertension, or pre-gestational diabetes, or gestational diabetes in a previous pregnancy or the current pregnancy. And to do this in the first or second trimester for symptoms of sleep disorder breathing, which they defined as loud snoring, nocturnal gasping, witnessed apneas, which means stopping breathing during sleep, or daytime sleepiness or excessive fatigue. And they recommended that the person has a home sleep study, but it shouldn't be just an overnight pulse oximetry. So not just looking at their oxygen levels, they want a home sleep study. I don't know how many obstetric and midwifery teams know about this guideline in the world. Please share. So, nasal congestion. I've already said 20% of women have it, and in that guideline, they're saying that it interferes with treatment. And this study here, it was a small study, but it was healthy women, had a sleep study, they did not have obstructive sleep apnea. They completely blocked their nose and they got obstructive sleep apnea. So nasal congestion is a problem. This group of experts came together, and these are the experts that prescribe or deliver CPAP, and this is what they produced as their workshop report. So nasal CPAPs, the CPAP machine that goes uses a mask that goes over the nose, should be the initial option for most patients. Mouth breathing is common among OSA patients, and nasal symptoms are common and compromise adherence to treatment. And they encourage us to do what we can to basically make the nasal symptoms better. They said that most studies suggest nasal CPAP essentially is more effective and better tolerated. And what I found in my journey as a breathing practitioner is the more you use your mouth to breathe, the more the nose blocks. And the more you start to improve and start to re-establish nasal breathing, the more the nose opens up. But I've also found that improving your tolerance to your waste product tends to help open up the nose, and I'm going to be explaining that more in greater detail. But these are just a selection of some of the feedback that I've got from those on my Breath Doc group and Breath Doc individual programs. Clearly, there are many causes for nasal congestion, which might involve seeing an ear, nose, and throat surgeon using various different medications or nasal sprays. But the most common overlooked reason for nasal congestion that I see both as a GP and a functional breathing practitioner is the person using the nose to breathe whilst at rest, moving and sleeping, and what's their carbon dioxide tolerance? So what's their tolerance to their waste product? So how are we going to work out how efficiently someone's breathing? And ideally you do this before you get pregnant because it's much easier to improve your breathing efficiency when you're not pregnant. It's really complicated when you're pregnant. So the first question is, are you mouth breathing? So at rest and sleeping, are you using the mouth to breathe? How do you breathe when you're asleep? Is your breathing noisy? Are you stopping breathing during sleep? If you look at someone, and again, I'm talking about assessing someone who's not pregnant here, because breathing changes during pregnancy. If you're looking at someone, you can see them breathing, they're working harder. There might be different reasons for that, but if they're fast, upper chest, irregular or noisy, they're working harder with their breathing. Lots of reasons for frequent sighing and yawning, but I frequently see if you improve someone's breathing efficiency, the sighing and the yawning reduces. We've all been in an exercise class and we clearly breathe harder and faster as we start to exercise, but there'll be perhaps one person who's breathing really excessively compared to everybody else. Lots of reasons for that, but one is they started the class already breathing hard and fast. It's really complicated to assess breathing, and Keisel and colleagues looked at all the different methods. I actually think it's quite a good paper. It's not a diagnostic tool. It's suggestive that the breathing might not be as efficient as it could be. It's not relevant for pregnant individuals. I've got a video explaining it and the link to the papers in that YouTube video notes. And essentially they think testing a comfortable breath hold time with 4 questions is quite a good method of assessment. So how do we improve someone's breathing efficiency? Well, breathing is really complicated, so it could involve all these different people and lots of others. Some are available on the NHS and some aren't. Ultimately, it's trying to establish what's the underlying cause for not breathing efficiently and then personalising the treatment to that problem. So really, it should be a personalised multidisciplinary team approach. We're not there yet, certainly not in the NHS. From my perspective as a functional breathing practitioner, I am thinking we're breathing through a collapsible tube. So how do I make that tube bigger? I help individuals understand correct tongue position, nasal breathing, and strengthening the muscles around that area. Then I'm thinking about how much air are we bringing in and out. Some of us overbreathe, so breathe in excess of what we actually need for our metabolism at that point in time. If we breathe slowly, our breathing becomes efficient, and you can train your body to unconsciously breathe more slowly. And the correct biomechanics. We've been designed to use certain muscles, and our breathing is efficient when we do that. And don't hold the tummy in. That was where my breathing went wrong when I was 10. Don't hold the tummy in, it compromises the breathing. The tummy and the whole core, which involves the diaphragm, the pelvic floor, tummy muscles and spinal muscles, is designed to beautifully move as we inhale and exhale. So what is efficient functional breathing? It's really complicated because it's the foundation of life. And you know that because if you try and hold your breath, at some point you have to breathe, otherwise we're not here on the earth. So there's 3 dimensions of breathing. So if you just remember, breathe light, breathe low, and breathe slow. So biomechanical is all about using the correct muscles to breathe, and I call that breathing low. Psychophysiological is all about if we breathe slowly, it's really brilliant for our mental health, but also for a healthy autonomic nervous system. And biochemical, it's all about, are we excessively breathing? So are we over breathing, breathing in excess of what we actually need, and all in combination with 24-hour nasal breathing. So in my clinical experience, we often talk about slow diaphragmatic breathing, but there's so little research about the biochemical dimension. And I've tried to work just on diaphragmatic and slow breathing, but I've had much better outcomes actually starting with improving the biochemical dimension and re-establishing 24-hour nasal breathing and then working on the other 2 aspects. So it's complicated. So just try and give you a really brief summary. So the biochemical dimension, so that often I've found is driven by our tolerance to our waste product. So we breathe in oxygen, we breathe out carbon dioxide, which is our waste product. But carbon dioxide is not just a waste gas. It actually helps release oxygen to our tissues. And we have a personal tolerance to it. So in our receptors, in our breathing center, we have a tolerance to our carbon dioxide. And when we hit that, we feel air hunger. So that might be someone feels a feeling of I need to open my mouth, I'm not getting enough air in, or I hope this is not a triggering term for anyone, but feel slightly suffocated. And I term that air hunger, and it'll kick in at different points. So if I had everybody at the bottom of a hill and I said, right, we're all going to march up this hill, breathing in and out of our nose. And when you feel air hunger, so that feeling of slight suffocation, I need to open my mouth, not getting enough air in, I just want you to stop. And we'd all be up the hill at different points. And I would have been at the bottom initially. And I've worked on improving my carbon dioxide tolerance in combination with 24-hour breathing and other aspects. And now I can actually run up a hill maintaining nasal breathing. And my exercise tolerance has improved. I feel calmer, and my sleep's just so much better. I didn't particularly have much nasal congestion, but from those that I work with, I've seen significant improvements with nasal congestion with that. And the only way, if someone's over breathing, the only way to correct that is to practice breathing exercises where in the moment you under breathe, but in a way that's safe. And then you allow your body to recalibrate to go to the volume that you actually need. And it has to be done carefully. And if you're actually pregnant, it's a bit difficult because there's only certain aspects that we can do depending on your trimester of pregnancy. Much better to do it before. Just going to try and give you a quick demonstration just to sort of understand. So if we put one invitation to put one hand on the chest and one hand on the upper tummy, have a posture that's helpful for health. So like a string at the back of the head, just gently pulling you up. Okay. And let's just start to mouth breathe. So I can hear myself breathe. So I've gone heavier. My upper hand is moving more. So I've gone higher. And I've gone faster. And now I'm going to close my mouth and maintain that helpful posture for breathing and breathe in and out my nose. I've gone quieter, so I've gone lighter. My upper hand is hardly moving. And I've gone slower. And if we go heavy, high and fast, we're turning up the dial on the fight, flight, freeze response. If we breathe light, low and slow, we're turning up the dial on the relaxation response. If we just let's see what difference it makes for a heavy breath and a light breath, but with nasal breathing. So if we go, so we're taking a big breath. Oh, sorry. Sorry, let's do it with the nose. So if we take a big breath through the nose, and now a light breath through the nose. So if I take a heavy breath through the nose, you see my upper chest and neck muscles move. But if I'm taking a light breath through my nose, I get more movement lower, which means I'm breathing more with my diaphragm. So we now understand the difference the nose and a heavy or a light breath makes. Now about posture. So sort of round your shoulders, crumple your diaphragm, have forward head posture, and start to breathe in and out of your nose. And now put that helpful posture for breathing. So for me, when I go forward, I have to breathe heavier, faster and higher. I can really feel my shoulders moving, the upper chest. But when I'm up here, I'm lighter, lower and slower. So that hopefully demonstrates to you, although we're all a bit different, but and it would be different if you're pregnant and doing that. Generally, if people have a helpful posture, that helps breathing be lighter, lower and slower. If you're breathing through your nose, it helps be lighter, lower and slower. And also if you're breathing lighter, you're more likely to breathe lower and slower. Children mimic others. So then we've got to consider, how are people breathing? The people the child spends a lot of time with, are they mimicking healthy breathing patterns or unhealthy breathing patterns? Because we want that child to have a healthy breathing pattern. It's crucial that a child continues to breathe as nature intended. They're going to get loads of colds, and parents, caregivers, all need to know the importance of getting that mouth closed after a cold, or teaching the child to blow their nose properly when they're at an age to do so. The blog there, the QR code, is for a blog that I've done with Charlotte Marsh, who's another breathing practitioner, and we put all the reasons why it's so important children continue to breathe as nature intended. We've referenced it, we've given advice. Please share it. My wonderful practice nurses give this to parents at the third set of immunisations now, and because I want parents to know this information. Unfortunately, if children don't breathe as nature intended, it actually has far more negative impact than certainly I even realised on both childhood growth and development. It can affect all these areas that you see here. I am delighted that Charlotte and I have come together to create a course called Supporting Children Towards Better Breathing. And this course is for anybody who has a personal or professional connection with a child and wants to help that child continue to breathe as nature intended. Also, if you're guiding or teaching breathing exercises to children and you have not had specific training in children's breathing exercises, please join the program, because children breathe differently than adults, and we cannot just take an adult breathing exercise and give it to a child. So 5 takeaways. We have been designed to breathe in and out of the nose. How we breathe whilst awake impacts sleep and bodily processes. Hormones affect how we breathe, and breathing light, low and slow increases the relaxation response. And children mimic behaviour, including your breathing habits. So thank you ever so much. I'm really keen to spread my message, so please share my social media platforms. If you'd like my help and you're not pregnant, join my Breath Doc group or my Breath Doc individual program. If you're pregnant, reach out for 2 one-hour virtual breathing consultations with me. And if you're keen to support a child, please join the Supporting Children Towards Better Breathing program. And I do have lots more information on my website. So please, thank you for listening. Thank you for considering how you breathe. And by all means, share this presentation so others can benefit.